PART 365. Myself Srija. Today in the session you are going to learn about the ICD and CM coding guidelines for diseases of the integumentary system. So in this session you will be learning about the chapter 12 of ICD and CM. So what does this chapter include? This includes codes related to the disease affecting skin and subcutaneous tissue. Subcutaneous tissue is nothing but it's a layer beneath the skin. So what is the first guideline? About pressure ulcer stage codes. So what are pressure ulcer stages? So pressure ulcers are also called as bed sores or decubitus ulcers. So these occur when there is a constant pressure on the skin. So usually the patients who are bedridden or immobile. So how do you code the pressure ulcers category L89? So whenever you are assigning ICD and CM codes for pressure ulcers in L89, you must code two key details. So what are those? The site and stage. Site means where the ulcer is located. For example, it may be a sacrum, heel, elbow, hip, ankle, or etc. And also the stage, how severe the ulcer is. So the ICD and CM identified pressure ulcers based upon the severity. Like stage 1, for redness, the skin is not broken. Stage 2, loss of skin involving the epidermis or dermis. Stage 3, full thickness skin loss involving the subcutaneous tissue. And stage 4, full thickness skin and tissue loss with muscle, tendon, bone exposed. And deep tissue pressure injury. Like it may be a persistent deep red or maroon discoloration underlying the tissue damage. So there is also the unspecified stage whenever the stage is not documented, and there is also the unstageable stage where they cannot determine the stage due to the slough or eschar covering the ulcer. So what is the coding rule whenever a multiple ulcers are diagnosed? So if a patient has more than one pressure ulcer, you have to assign multiple codes from L89. So one code for each ulcer, like including both the site and stage. So how do you code them? So section IB14, it allows pressure ulcer staging documented by the clinicians other than the provider. For example, like wound care nurses. So this means coders can use this tagging done by other qualified clinicians even if the physician did not mention the stage. So pressure ulcers are coded from L89 category only. You have to always code both site plus stage. So these stages, they include 1 to 4, unstageable, unspecified, and also the deep tissue pressure injury. So multiple ulcers are diagnosed, you have to use multiple L89 codes. For example, if a documentation says stage 3 pressure ulcer on right heel and stage 2 ulcer on sacral area. So what is the coding logic here? Right heel plus stage 3, you have to code one L89 series, and sacrum plus stage 2, you have to code another L89 series. So final result is you have to assign two separate L89 codes for different site and different stages. So this is about coding the pressure ulcer stages. So the second one is unstageable pressure ulcer. So how do you code unstageable pressure ulcers? So a pressure ulcer is called as unstageable when the healthcare provider, they cannot determine the severity of the ulcer. So because the wound surface is covered or obscured. So when do we assign a code ending in 0, like L89.0, only whenever the documentation states that ulcer is unstageable. So this happens whenever the base of the ulcer is not visible. For example, covered by, whether it is covered by eschar, nothing but a dead or black tissue, whether it is covered by a slough, or it is covered by a skin graft or muscle graft. So medical dressing or debris that prevents the visualization. So what is important here? What is unstageable ulcer and what is unspecified stage ulcer? So unstageable ulcer is nothing but the stage cannot be clinically determined. So whereas unspecified stage ulcer is stage is not documented anywhere in the chart. So unstageable, doctor tries but cannot determine the stage. Whereas unspecified, doctor never documented the stage. So what is the specific coding rule over here? After debridement, sometimes during a hospital encounter, an ulcer is first unstageable. So then after debridement, then after removing the dead tissue, the stage becomes visible. For example, stage 3. So in that situation, you have to assign only the code for the revealed stage. For example, stage 3, you have to assign the code L89.3. So you have to do not to code the unstageable first and stage later. So you have to only code the final stage. So this is the coding rule for unstageable pressure ulcers. So then how do you code the documented pressure ulcer? So when assigning ICD-10 CM codes for pressure ulcers, you have to always code the stage that is documented in the medical record. So what are the coding rules for this? If the provider clearly documents stage 1, stage 2, stage 3, stage 4 or unstageable or deep tissue injury, etc., you have to assign the corresponding L89 code. So if the wording for the stage used by the provider is not found in the ICD-10 CM alphabetical index and the stage is unclear, then you have to query the provider for clarification. You should never guess the stage even if the own description is given. So this is how you have to code the documented pressure ulcer stage. So what is the guideline when the patient is admitted with pressure ulcers documented as healed? So if the patient comes to the hospital and the documentation states pressure ulcer completely healed at the time of admission, then you should not assign any pressure ulcer code, no L89 code, because what is the reason over here? ICD-10 codes apply only to the current active conditions but not the past healed ones. So this is how you have to code whenever the document says ulcer is healed. So how do you code whenever the document says it's healing, ulcer is healing? So sometimes the chart states healing pressure ulcer instead of giving a stage. So you have to code, you have two coding rules over here. The first one is healing ulcer plus the stage is mentioned. So you have to assign code for the documented stage. The second one is healing ulcer plus stage is also not documented. Then you have to assign unspecified stage, that is L89.9 code. So a healing ulcer is always still an active ulcer. So it must be coded unlike the healed ulcers. So these are the key points for guideline 3, 4 and 5. So if the chart is unclear about whether the patient has a new pressure ulcer or a healing pressure ulcer, the coder must query the provider for clarification. So if the ulcer was present on admission but healed at the time of discharge, you have to assign the code for site and stage at the time of admission. You should not code as healed because it was active at the admission. So what is the coding guideline whenever a patient admitted with pressure ulcer evolving into another stage during the admission? So sometimes what happens, the ulcer worsens during the hospitalization. So if the ulcer progresses to a higher stage during the stay, you have to assign two codes. The first code is for site and stage at the time of admission, and the second code is for same site plus highest stage reaching during the stay. So what is the reason over here? ICD-10 CM, they requires tracking the patient's condition on admission and the progression during the hospitalization. For example, stage 2 sacral pressure ulcer on admission, but it progresses into stage 3 during hospitalization. So how do you code? You have to give two codes. One code for admission, that is sacral pressure at stage 2 L89.2, and the other code is for during the stay, that is sacral pressure ulcer for stage 3. So you have to assign different codes for the admission and also during the stage. So next, what is the coding guideline for pressure induced deep tissue damage? So deep tissue injuries, they involve the persistent deep red, maroon or purple discoloration. So this is the damage due to the underlying tissue without open skin loss. So what is the coding line? You have to assign only the deep tissue injury code as L89.6. So you should not assign additional stage codes such as stage 1 or unstageable whenever a deep tissue injury is documented. You have to only code the L89.6 code. So these are all about the guidelines for pressure chronic ulcers. So what are the guidelines for non-pressure chronic ulcers? So patients admitted with non-pressure ulcers documented as healed. So these ulcers, these are not caused by pressure. So what are the common causes they include? They may include diabetes, venous insufficiency, arterial disease, neuropathy, trauma or infection. So they are coded from the categories other than the L89, such as L97 for non-pressure chronic ulcer of lower limb, L98 for other non-pressure ulcers. So when a patient admitted with non-pressure ulcers documented as healed, if the chart clearly states that non-pressure ulcer is fully healed at the time of admission, then no non-pressure ulcer code should be assigned. What is the reason? ICD-10 codes apply only to the active conditions. I have said you earlier. They only apply to active conditions at the time of admission, but not the past healed ulcers. So how do you code when non-pressure ulcer documented as healing? This is same as the pressure ulcers documented as healing. So if the document states the ulcer is healing, it means the ulcer still exists. So it must be coded, right? How you should code? One, coding for the severity. You should assign code for the severity whenever document says healing ulcer plus severity documented. So whenever healing ulcer plus severity is not documented, you have to assign the unspecified severity code. So unlike pressure ulcers, non-pressure ulcers are also staged by severity but not by the stage numbers, that is 1 to 4. Right? We have stage numbers 1 to 4 for pressure ulcers, but non-pressure ulcers we do not have any stage numbers. We only assign the codes based upon the severity. So what are the examples of severity terms for non-pressure ulcers? Limited to breakdown of skin, with fat layer exposed, with necrosis of muscle, and with necrosis of bone. So what is the important clarification rule for this? If it is unclear whether the ulcer is new or the patient is being treated for a healing ulcer, you have to query the provider. So never assume whether the ulcer is new or healing without clear documentation. So ulcers present on the admission, but they are healed at discharge. So how do you code them? If the patient has non-pressure ulcer at the time of admission and it is healed before discharge, you must assign the code for site plus severity at the time of admission. You should not code that is healed at discharge, like ICD-10 captures conditions on admission but not the outcomes. So, patient admitted with non-pressure ulcer that progresses to another severity level during the admission. Sometimes a non-pressure ulcer worsens while the patient is hospitalized. So, what is the coding rule over here? If the ulcer progresses to a higher severity level, then you have to assign two codes. The first code is when what it represents the site plus severity of the ulcer at the time of admission. This is for the first code. For what the second code is, same ulcer site plus the highest severity during the stay. For example, if the documentation says during admission non-pressure ulcer of right calf with fat layer exposed, whereas during stay progress to necrosis of the muscle. So what is the correct coding for this? You have to assign L97.2 code for fat layer exposed on admission, and then you have to assign L97.3 code for necrosis of muscle, that is for higher severity documented. So why two codes? Using two codes, it shows patient condition when admitted. It also shows disease progression while hospitalized, and this supports clinical accuracy, DRG or reimbursement integrity, and also quality reporting. So what are the main points to you to memorize? So ulcer healed before discharge, you have to code severity at the admission only. If ulcer worsens during stage or during the stay, you have to assign two codes. Then what happens when severity is not documented? You have to query provider or code unspecified. So whenever document says the healing ulcer, then you have to still code as active, because healing word it gives the active. Then ICD-10 CM codes are assigned for the active cases. Then you have to still code as active, assigning the severity. So how do you code when healed ulcerate admission? There is no code because it is already healed. It is in the past. You should not involve the past for the ICD-10 CM codes. So what do you learn about the pressure ulcer and non-pressure ulcer? So what are the main differences? In pressure ulcer, the stage increases, whereas in non-pressure ulcers, the severity increases. So how do you code in pressure ulcers? You still code two codes, one for initial and for highest. Whereas non-pressure ulcer, it is same as the pressure ulcer, two codes, one for initial stage and second for the highest severity. The pattern is the same, but the worsening condition has the two codes. So this is about the guidelines regarding the skin and subcutaneous tissue diseases. So that's it for today's session. I hope this session has helped you. So in this session, you have learned about the ICD-10 coding guidelines for the diseases of the skin and subcutaneous tissue. So in the next video or in the next session, you will be able to learn about the ICD-10 coding classification for chapter 12 ICD-10 codes. Thank you.